Hey guys, welcome back to the Energy Equine YouTube channel. This is kind of a new thing for us. We're trying out. We have the podcast, we have the Facebook page, and now I guess we're on YouTube. We're doing the most at Energy Equine, but we have the time to do it, and we wanted to get some education out there for those of you that are at home. A big thing that clients have been asking us is, what should I still be doing? Can I pick up vaccines? Can I pick up wormer? Can I bring my horse in to get that done? Some people are more confident giving vaccines than others. So we wanted to touch on vaccines today, especially given that we do hope that we'll be back showing and taking our horses out at least this summer. And so we do still want you guys to be cognizant of that. So today I have Dr. Travis Kelter with me of Energy Equine. Trav's going to talk a little bit about spring maintenance and what it means when we talk about vaccines with that in mind. So Travis, I'm our routine horse owner. I bring my horse to maybe a couple shows or rodeos in the summer. I'm hoping that rodeo season's coming back. What are you recommending for vaccines?
Yeah, so I guess first of all, I hope everybody's pretty happy and staying sane in this kind of strange time, and it's kind of nice to see everybody banding together. And I guess we can talk a little bit about what you can still do to keep your horse in tip-top shape, even though we're maybe not having our usual show season and kind of doing our usual daily routines. So vaccines are still very important. Some people, I think, have been viewing them as a bit of an elective procedure, but there's a lot of diseases that are prevented by vaccines that are spread through mosquitoes or other insects, and they don't know about COVID. So they're still going to be out. They're still going to be doing their thing.
Horses are not inside. Well, some are, but...
Exactly. And the one that's really coming to mind for me is West Nile virus. So it's spread by mosquitoes. It has had a bit of a rise in Alberta in the past couple of years with a number of cases we've been seeing, and it can be up to 33% fatal in the horse. Those numbers are not entirely nice, which emphasizes the importance as to why you should be vaccinating your horses still. The other big one is tetanus. It's in the soil. Horses like to get a lot of nicks and little wounds, and you just need a little break in the skin and entry into there, and again, it can be a fatal bacterial infection. So important to keep your horses boosted. And then, for those of you with brood mares and things like that who may be in foal, it's still very important to vaccinate against certain things like rhinopneumonitis or your equine herpes viruses, because they can result in abortion. So it's still very important, regardless of what else is going on in the world, to keep your horses vaccinated and to keep them kind of in good overall immune status and health standing, so that they can battle the normal things that they see, especially during the summertime. So in addition to just vaccines, other things that should be probably looked at and kept up to date, if not right now, then as things sort of start to quiet down. Teeth are very important. It's the entry and the first kind of gateway, I guess, into your horse's nutrition. So if your teeth aren't working properly, then the rest of your horse's health could be compromised to some extent as well. And then worming is probably your other big one at this time of year. And keep it fairly simple, but an ivermectin-based product is a very good product to use at this time of year. It gets a large number of your common worms, and it's also very good for brood mares who may be dropping a foal as they drop to the ground, because ascarids are one of the common worms that you need to watch out for in foals, and ivermectin helps take care of those. So as the foal hits the ground, you can give your mare a ivermectin-based dewormer. There are other dewormers that are also very good and appropriate to use at this time of year. And if you're going the ideal kind of gold standard medicine mode of practice, then we recommend performing a fecal egg count as well, and looking and seeing if your horse may be a low, medium, or maybe high shedder of parasites, and that can kind of guide your decision if you need to deworm at this time or not. So you may save a few dollars on dewormer if you have a horse with a low fecal egg count.
Yeah, and I was going to actually interject and say, I kind of, as we were talking, I was like, oh yeah, fecal egg counts, but we're still able to, currently the labs are still open, So if you wanted to collect a sample and bring it to us in our Dropbox, we can send it out for you and kind of communicate over the phone, do some telemedicine, like our industry's been saying. So we can still work with you, just in a different capacity than maybe we're used to right now.
Yeah, exactly. And so we've been trying to be quite cautious during this time and, practice good biosecurity measures as best that we can. Like we said, telemedicine, for those of you who don't quite know what that might mean.
It's that word for just like calling you on the phone.
Fancy word for phone, using the phone. So basically we have people tie their horses to the trailer, they get back in the vehicle, and then we come out, grab a horse, bring it in, examine it as quickly but efficiently as possible, and then tie the horse back to the trailer and call you or FaceTime you or something like that to communicate what we've been doing, concerns we have, or what the next step is, or to give you the thumbs up and say you've got a clear bill of health and you can be on your way. And this is why we're bringing this up for vaccines, deworming as well, because they're two very important things to keep up on. And it's very easy to practice this still at a distance, particularly if you're proficient with giving a vaccine or an intramuscular injection. And for those of you who aren't but want to learn, we can maybe help you out with that as well.
All right, guys, welcome back. Today we have Jingle with us now. Jingle is, I think, 16. He's my old retired pain horse. He used to do a little bit of everything. He sustained some injuries, so he's been retired for a couple of years. So because he's in the field, we brought him in for these demonstrations. So if he's a little quirky, I mean, he doesn't really get handled that much these days. But he's really cheesing for the camera right now.
Yeah.
He's like, maybe this is his new calling. Veterinary YouTube horse.
Yeah.
All right. So Travis is going to take it away. He's got some demonstrations for us, and he's going to kind of teach us a little bit about how to safely IM, which is intramuscular injection, for a horse.
So this is Jingle, as Louisa said. We have an interesting relationship. He sometimes likes me, sometimes doesn't, but that's okay. I'm hoping he doesn't try to channel his inner Mustang today. So he's our little guinea pig for our IM injection or vaccine. So a few things to really consider when you're giving any injection or really working around a horse is have a competent handler who you trust and who,
you trust me?
Yeah, and I do, and who's got a nice calm demeanor to be around the horse, because if you're not calm, they really read that, and if you're nervous about giving an injection, they're gonna take your number and you're already starting off on a bad foot. So have a good handler. Make sure you're confident approaching the horse. I want you to stand in a good position, both ideally on the same side of the horse, so that if they move, you can move together, and that if people are on either side of the horse, somebody's going to get knocked over if they move suddenly. The other thing I think when you're giving a vaccine at the front end of a horse to consider is if they're a little nervous, make sure that you don't get struck or pawed by the horse, so make sure you're not standing right in front of them, but kind of off to the side. Some of those horses that are needle shy, don't walk up to them like with a sword as the needle. The tape here is just to show your general landmarks of an intramuscular injection on the neck of a horse. So you have 3 key things to really be watching out for: the cervical spine, or the vertebrae running from the top of the head down. It starts right up here near the head, and it kind of runs down like this right here. So we definitely don't want to be poking into the vertebrae or the spine, so we want to avoid that. Your other big landmark is the nuchal crest running down here, so we also don't want to poke them there. And then the scapula is kind of right in here, or the cranial border, meaning closer to the head, is kind of here. You do not want to poke them there. Those are your landmarks, and if you draw kind of a triangle between them, you're left with this. Some people will give you a general rule of thumb to use your hand off the scapula and make sure you're at least a hand's width this way. Then what I like to do is feel for a nice meaty kind of piece of the muscle, and that's where I'm going to go. moving on to the actual, I guess, vaccination process, a couple other little things I like to do is just let the horse know you're coming. I usually always try to keep a hand on the horse at one time, and I like to just grab a little bit of a skin tent like this. You don't have to pull on them hard or, you know, pinch too hard, but get a nice, you know, firm grasp. And this does a couple different things. As you saw when I grabbed him here, his head kind of turned. It diverts their attention from thinking about getting a poke to, oh, why are they kind of grabbing my skin? So it's a little bit of a distraction. The other thing is it kind of desensitizes right behind the skin tent a little bit so that when you poke, it's not so alarming. So then the next thing is you can just slowly take that vaccination or that needle out. You shouldn't use your mouth to take the cap off in case you poke yourself in the face. And then what I kind of do is using my pinky or something, just wrap it around and take the cap off. I use my ring finger, or if you have a smaller hand, some people their middle finger, to pull back on the vaccine. This is a critical step in any kind of injection. So you take the vaccine. It's best practice too to also take the needle off. And so particularly your nervous horses, or if you're not as confident giving an injection, this is how you should do it. And you're going to bury this all the way to the hub of the needle right here. So are you ready? And you're going to inject quite quickly, and in one motion pull everything out. Then you're done, give him a break, tell him he's a good boy. He handled that amazingly well. If you see a little bit of blood like this, that's all right. Usually as we pull out or sometimes enter, we nick a little vessel and it's not a big deal. So,
except when you have a paint horse.
Except when it shows up like this. But
so Travis, we've given the vaccination.
Yeah.
I know some people get a little nervous about vaccinations. So
absolutely.
What are some things I should be looking for to ensure that it all went smoothly? Obviously, we didn't have blood in the needle.
Yep.
But are there certain things I should be looking for, signs and symptoms? When should I be calling a vet?
100%. So anytime you get any kind of reaction, you should call a vet for a few different reasons. We often communicate with the makers of the vaccines and the drug companies, and so when we have reactions, if we're having a lot of them, then it could be maybe a problem with the batch, or it could just be a one-off incident. But if they're getting a lot of reactions, they might want to reconsider what they're putting in their vaccines or how they're preparing them. So it's I guess a check and balance for the vaccine company. And the other thing is that we want to know and make sure that it's nothing that we've done in our practices. Again, if we're having a high number of reactions, then maybe we need to reconsider something. If not, we just need to document and log it. Common problems are I'd say the most common things I see are like a bit of a local lump that goes away either on its own or with a little bit of basically a non-steroidal anti-inflammatory is what's commonly given to just help them out, a one-off dose or something. Sometimes a stiff neck. If your horse cannot lift or lower its head to feed and drink, that's a problem I want to know about right away. If they're just a little bit stiff but can still move around and turn their head adequately, that's not too big of a problem. I'd say those are the most common things. It can be usually as dramatic as, or I shouldn't say usually, it can be as dramatic as an anaphylactic type reaction, which are uncommon and usually occur within a few seconds to minutes of it happening. Other signs that sometimes creep up are, again, hypersensitivity type reactions or a bit of hives, across the body. Again, they often go away without much treatment. So inform your vet if any of these occur, and they'll be able to direct if you need to take any further measures or not.
All right, I think that about covers it, Travis. Is there anything else you'd like to add about vaccinations and spring maintenance? Yeah, one other thing just popped into my head. One other thing that I see people doing sometimes is splitting up vaccines, which may or may not be appropriate. So
in a lot of your vaccines, because they're what are called a killed vaccine, or they're basically just using a component of what you're vaccinating for, not the actual live organism or bug, then they have to put what's called an adjuvant into the vaccine, and that adjuvant kind of wakes up the immune system and goes, okay, I've put something into your body, you need to respond and remember it. And so by splitting up the vaccines, you're actually giving a lot more adjuvant, because each one of those vaccines has that in it. And the adjuvant is often what causes the horses to react, not the actual bug or organism like some people think. So in effect, by splitting up your vaccines, you may actually be increasing their risk to have one of these reactions, like a stiff neck or a local lump or something.
Yeah, and then I think other than that, we didn't do the strangles vaccination today. He has been vaccinated with strangles in the past, but because he kind of lives solo right now, he doesn't leave the farm, I decided not to do it. Also, I didn't know if he'd be very good on video.
He's a good example though. For strangles, for instance, it's a bit of a different vaccine. It's what's considered a live vaccine, and because it's quite a common thing in their environment and it can be a nuisance to deal with, it often doesn't cause, it's not something that causes a high death rate. It's very contagious though. But horses that start to get to mid-age or older have probably, like Louisa said, he's been vaccinated for it before.
Yeah, especially when he was at a boarding facility.
Exactly, and so his immune system has been primed quite well. He's also probably around the 16-year-old mark now. He's probably seen it naturally in his environment. So for horses that are staying on property, who the vaccine status of all those animals, they're not interacting with other things, they've been vaccinated before, that's a type of vaccine that I sometimes say to the owner, it's kind of up to you. For young, naive horses who may not have seen it, or horses traveling a lot and being exposed to other horses, I still think it's a good idea for a few reasons. They say that it reduces the severity of the clinical signs. So if they do get a strangles infection, hopefully their signs and symptoms are a lot less. And also the amount of time that you have to deal with it may be a lot shorter, and it is a pain to deal with. So, but one thing that is also key to note in the strangles vaccine is it's not fully protective. So again, you're using it to minimize signs or chances of getting it, but they can still get the disease. So.
And it is a nasal injection.
Yeah, and you just kind of sneak up on them. Sometimes you need a twitch and you go up their nose and just do a quick shot up there.
Travis, I did want to bring it back to vaccines.
Yeah.
So again, I'm your average horse owner. I hear things like 3-way, 6-way, all the ways, strangles. Yeah. There's all these, I can never keep it straight. So what is the gold standard? And when you hear 6-way, what does that mean?
So a 6-way vaccine encompasses basically most of what we vaccinate for. It has some of your core vaccines or risk-based vaccines in it. Core vaccines are things that we recommend your horse having, that it's more of a must-have, I guess. So things like tetanus and your encephalomyelitis viruses that affect the nervous system. Some people, depending on region as well, may include things like West Nile as part of your core vaccines. Your more risk-based vaccines are things like your flu, your rhino, where depending on maybe the age, sex of your horse, or how much you travel and how much you interact with other horses of maybe unknown vaccine status, that's kind of more of an optional one, so to speak. So,
so
in the 6-way,
the difference is maybe if your horse is just out in a field, like what they can get from mosquitoes, for example, like West Nile in this area.
Yeah.
And then what they could get if they were traveling, if they were exposed to other horses.
Yeah.
Etc.
And there's certain things like a rabies vaccine, which we don't give very much at this practice because we're not in a huge risk based area for rabies, it is here, and it's ideal to still vaccinate for that. But places further east or down south in the southern United States, the rabies is much more common, very important to vaccinate for. So that may be considered a core vaccine in those regions. As you walk through your vaccinations and hear the 3-way, the 4-way, the 5-way, the 6-way, basically you can think if the number is going up, the more things are in that vaccine that are going to offer coverage for your horse. So in a 6-way, that basically covers everything that we commonly vaccinate for, with the exception of strangles. That is a separate vaccine. And then, you know, I'd say kind of the basic one that most people will vaccinate for is at least a 3-way, which has your East and West Western encephalomyelitis virus, and also your tetanus in there. So that's kind of a very basic level of coverage. As you go to the 4-way, that starts to incorporate West Nile usually. As you go to a 5-way, you actually tend to lose the West Nile component. It's just they don't put it in that vaccine. And but what you get is your some more of your respiratory viruses coverage for that. As you get to the 6-way, again, you're covered for your East and West encephalomyelitis, your West Nile virus, your tetanus, and your flu and rhino. So again, the only exception there being strangles.
And you have the West Nile in the 6.
Correct.
So we've kind of covered the different types and what to generally vaccinate with, but what about timing? Or how many times a year should you be vaccinating, and when should you be vaccinating within the year?
Yeah, so general kind of rule, I think it's easiest to think if you have a horse that's already fully primed and sort of vaccinated. In that case, you're going to vaccinate your horse and boost them annually is the general kind of rule. If you have a younger horse kind of, or a naive horse, meaning you don't know if they're vaccinated before, or they just have, you know, the history, but you know, you're buying a horse or something and somebody tells you they've never been vaccinated, then you need a series of 2 vaccines, usually about 3 to 4 weeks apart. So your initial vaccine and then a booster vaccine 3 to 4 weeks down the line. That will give you adequate coverage in most situations. Younger horses sometimes need a 3rd vaccine into that protocol as a booster. So for a foal, for example, depending on the type of vaccine, you'll start vaccinating at the recommended age, and then 4 weeks after that, give a booster vaccine, and then, you know, 4 weeks, or depending on the vaccine, sometimes a little bit later, give another booster. And then they're usually covered till the year mark, and then you boost at the year and then go on with your regular schedule. For pregnant mares, it can be a little bit different. The key one to cover there is your EHV, or your equine herpes virus, sometimes referred to as rhino, because they can lead to abortions in the mare. And so the general recommendation for that, or for the vaccine that they commonly use, Pneumabort, is at 5, 7, and 9 months. And then some vets will also give something like a 5-way vaccine a month prior to foaling, and then they're covered. Some vets prefer to give the West Nile after, depending on the vaccine maker. Some of them are deemed safe in the pregnant mare. So,
yeah. And then I think my last question is like duration. So let's say I'm going to do all my vaccines in spring, let's say April. How long do they last? Like, does West Nile last the whole time? Does it only get me covered for a month?
Yeah, and so again, this is very, this can vary with the type of vaccine and also who makes the vaccine. And so they provide, some of them provide studies that actually have assessed the duration, and therefore they can put a little bit more of a guarantee. The one that I run into the most is with the West Nile vaccine. Some people have questions about that, and I believe in the early days with the vaccine, they could only guarantee that it's effective for up to 6 months. So considering that it's a mosquito-borne disease, some vets would delay the administration of the West Nile vaccine until closer to the vector season, being kind of spring, summer, when the mosquitoes are actually coming out. Now with advancements in what they use in the vaccines, they're being able to guarantee it for longer periods of time. And so horses are generally, like most of your other vaccines, covered for up to a year. Sometimes certain sports will deem that you need to vaccinate with other things or more regularly, or sometimes the boarding facility that you're at. And then the other thing is with some of the respiratory viruses or horses that travel a lot, sometimes they'll recommend vaccination every 6 months. So again, ask your vet. It's a little bit individualized to the horse, the owner, the management system, expectations, and maybe risk factors for that animal.
And then, yeah, other than that, you guys, given the current climate, if you really want to vaccinate your horses but you're not comfortable giving injections, you want to do that strangles and you're not comfortable doing it yourself, because it is a bit of a trickier vaccination. Yeah. You know, we are still available in clinic for appointments like that. We are asking for no contact appointments, but if you can bring your horses on the trailer, we're still happy to help you out that way. Or call and you can come pick up vaccinations, and we can kind of talk you through the process as well when you're here over the phone. So a little bit different than what we're used to come vaccine season, but but we're trying to handle it and make sure that your horses are being taken care of, so that when you can go back to showing and you can go back to hitting the road, your horses are protected and you have some peace of mind as well, and you're keeping up with your annual vaccinations. All right, Dr. Kelter, thank you. Jingle, thanks for not killing Dr. Kelter today.
Good boy, Jingle.
Very good. He said, I don't know why I had that tape on my neck, but you know, weirder things have happened to me. And we'll see you guys next time. Thank you.
Bye, everybody.